Good morning, everybody. It's always a real pleasure to be with you. And I really want to congratulate Mr. Trevidic for this amazing video. It's one of the best I've seen for a long time. We should really applaud this video. It's so informative. And to make the connection with what he just said, we have the perfect example of what he just said. I just discovered this lovely lady for the first time, and I assess and analyze her smile, and I think it's the perfect illustration of Dr. Trevidic videos. She's a very pretty young woman with lovely lips, and she would like to improve them. So, as usual, you have to assess the dynamic of the smile. It's very important. And with lovely lady, we're going to have a surprise, in fact. That's what I discovered a few minutes ago, in fact. The fact is, normally, when you smile, as we say, we have the bone and the gum. So the upper lip is leaning on the teeth and on the gum, and the upper lip is reversing naturally, increasing the volume when you smile. For some people, because of what Dr. Trevidic said about the different muscle, and especially the elevator of the nostril and the labial elevator, sometimes the lip reverse. The extreme reverse is what we call the gummy smile, the gummy smile. But for her, if you smile, please, you see, small smile, bigger smile, bigger smile, bigger smile. The more she smiles, the more you see the gum. And the more you see the lip reversing, going in. So it's a very difficult case, because you will always be betrayed by this. If you just filler augmentation, whether you do the outline or you want to plump the red part of the lip, the juicy part of the lip, she will be disappointed when she smiles, because whatever you do, how much you put in a quiet position, still position, it's going to be lovely, and we are going to define the outline and maybe the red part, adjusting the lower lip. But when she smiles, you will have always this problem, reversing. So you're going to lose one half, at least, of the lip augmentation. So the great combination for this lady, which we can't do it today because we don't have it here, is to combine with few drops, very superficial drops, or on the border vermilion, as Dr. Trevidic said, or to the ala elevator here to reduce this ascension and reverse of the lip. So let's keep that in mind, it's very important. Now, going back to using hyaluronic acid, and especially the RHA2, which is my new gold standard. I love this product. It has an amazing flexibility. I used to be a great fan for many, many years of Teoxane Global to improve the lips. I always say that. And I think the new standard for the lips in general is going to be this RHA2. It has an amazing flexibility, plasticity, easy to mold with the fingers, easy to dissolve if you have any problem. So I think it's the ideal product to do any sort of lips. Now, so what's my technique? So lie down. So we said we have to improve the outline and the red part of the lips. I use a very simple technique. I have lots of doctors working with me in my different clinics, and I always thought about having the simplest technique possible for them to do a good job and standardize the procedure. So came to my mind then to use a very short needle, a 4 millimeter, 30 gauge 4 millimeter needle, which allows you to control exactly what you're doing. Because with this length, you can or inject the outline. I work at the head of the patient. I pinch the lip. I see the outline. And usually also, to be very precise, I mark with a pencil the way out of the filler. See here, I know exactly where the filler is going out. I can be extremely precise. So then I pinch my lip. Can you see it? I pinch my lip. And I'm going to try to find this virtual, can you see it? This virtual canal that you can easily find. You see, my needle is 4 millimeter, maybe 2 millimeter deep. Exactly, you see? And I can really mold, you see? If I have too much hyaluronic acid, I can take it out. You see, that's just for the outline. Thank you. I carry on. Pinch again. You see, I have a tendency to turn, so because I put the marks exactly, I know exactly where the filler will come out. Same thing, same depth, you see? You see the whitening going along the rim? That's perfect. I pinch, always. Very gentle, very delicate, simple and easy. Up, you see, it's going on the other side. I don't inject the red part for the moment. I will show you after how to do it, okay? At the moment, I just control the outline. The definition of the lip, I increase it. Because some people want just the outline, some people want juicy, more full lips. So you have to be able to control exactly what you're doing. Same thing. I have to be more precise. Voilà. Can you see the outline? The whitening going all along the border. I press.
Jean-Louis?
Yes?
Do you hear me? It's Patrick Trevidic.
Yes?
May I ask you a question?
Yes?
When you do that,
Yes.
do you do sometimes some local anesthesia or something for
I never
your
use
patient?
any local anesthesia.
You never use?
Not
Do you
even
use
cream. Not
E-
even.
Even EMLA or something
Not
like
even. You can if you want. But I pinch the lip. You know, I pinch the lip, and honestly, it's really not painful. I
Oh.
use this short needle.
How
But-
many spots you put on your lips? You put 3 by side?
It depends. It depends the way I capture the virtual canal. Sometimes it runs all along in 1 or 2 dots. It's finished, you see. Look, for example, I maybe adjust here. Now, okay. Can you wet? Mouillé? Ah, it's wet. Okay. Let's see. That is the outline. Let me, sorry. Can you sit up, please? Asseyez-vous, s'il vous plaît. Smile. Sorry. I just check my outline. Seems correct. Okay. But now I'm going to do the outline of the lower lip, and then I will plumb the lip. Alors, the outline of the lower lip. 2 ways to do it. Classic. You can go all along the outline like this. Open your mouth. Open your mouth. Ouvrez la bouche, pardon. You put your finger in. You see the whitening of this virtual canal, and you can go like this. You see, tack, boom, all along. You see, it goes all along, and that's beautiful. But open your mouth. I can do that. I prefer personally, close your mouth, to carry on my technique, reversing the lip like that. Close your mouth. Fermez la bouche. Fermez la bouche. Souriez. Smile. Close smile. You see, you ask a close smile. Close smile. Fermez la bouche et souriez. Fermez la bouche et souriez. Voilà. Okay. Now, just, voilà, petit sourire. Now, I press like this. Okay, I press, I reverse. And I'm going to do the outline of the lower lip from here. Lower middle part, you see? 1 prick. And it goes all along. Can you see? And I go like this. I press, I push the extra drop outside. That's my favorite technique, personally. I call that the sexy drop, in a way. I do just 1 drop most of the time. That give me, please sit up, that give me the balance, you see? It's perfect. Now, you see, I have done some drops here, and it's missing on the other side. Normally, I don't do that, but I will have to do it to balance it. Open your mouth. Ouvre la bouche. No. It's a very old technique for me, this doing the outline this way. Okay. Now, it's quite nice. Faites voir. Un Kleenex. mouchoir, Kleenex? Ah non, il n'y a pas de Kleenex. Then you check. Asseyez-vous. Let me see. Souriez. Alors, it's a bit in balance. I press, as you can see. I press. It's malleable. Faites voir. Smile. Souriez. It's better now. Smile. You see, the lip is a bit thicker here than here, as you can see, so no problem. I can go back, adjust, still from the back. Et voilà. Tout de suite, c'est très simple. It's very simple. Faites voir. See? Voilà. Souriez, smile. It's much better. I think it's still missing here. Et voilà. Tout ça, all this came from the fact I start injecting on the other side, the outline on the other side. So you can combine, you see, or injecting directly the outline, or starting with a souriez, smile. Okay. You see, ça c'est très joli. Now, if she wants more fuller lips, how should I do? Okay, because technically I have just improved the outline here. I didn't plump the red part of the lip. And let's see already the dynamic of the smile. Souriez, smile, smile, smile. You see, as I told you, unfortunately, you're losing a lot of what you've done. See, it's always reversing. Sorry. Smile. You see? More, more. Look, regardez. It's unbelievable. Such a pity, okay? So the patient will be disappointed, always. So if you don't do a bit of Botox here and here, you will be in trouble, and the patient will be disappointed. This is a very classic case. Smile. So analyze the dynamic of the smile. It's essential. More, more. Regardez, terrible. You see the gum now. It's not right. So I can be tempted to make the lip fuller. How do I do?
So may I?
Yes?
Maybe a question, yes. Until now, you use the 1 milliliter, about
Yes,
1
yes.
milliliter of product. And
Normally, I rarely use more than 1 milliliter. It's exceptional.
And normally, how much do you put in each injection? Not more than 0.1, I saw in the video, I think.
I don't know. It depends on the
okay.
lip. I don't know. You go with the feeling. I don't know. Can't be so precise. You do what you have to do. I don't know. Sometimes you put very little, sometimes you put a lot. I don't know. Doesn't really matter. What matters is the result.
Yeah.
So just to show you, if I want to plump up these lips here, so always using the same needle, the 4 millimeter needle. That's why it's so useful. If you remember, I just used at no more than 2 millimeter. Now I can do that. Look at this. I reverse the lip, my thumb. I go tangent. I know exactly where my filler is coming out. And I, inside the red, you see, introduction, can you see it? And I go, boom. The 4 millimeter is in. And now you can see the filler going in the red part. And I can mold and sculpt it. Of course, you can put as much as you want. Depends on the lip. Same thing, I reverse, tangent, boom. You see, it flows. Simple. Very gentle. I've done 2 dots. I'm going to do exactly the same. Reverse, tangent, 4 millimeter. Because if you go a bit lower, let's say 6 millimeter, the filler will come here and will make funny lumps. So you have to be very precise. Massage, placement, sculpting, essential. Same tangent, 4 millimeter, boom. Press, gentle, that's it. You see, on this one I put 0.02 millimeter. So now we have the full lip. And I may need to adjust the balance between the upper and lower lip. Wow, you see the juicy lips now? Different, more juicy, yeah? You can see the difference. It's much more juicy. Smile, smile. See, same punishment. Oh, horrible, okay? If you don't deal with the muscle, you're going to be punished. Again, you can put as much as you want. Smile, souriez, souriez, souriez. More, regardez ça. C'est terrible, terrible. Okay, so I insist for you to really understand that. Because, you see, in a quiet position, it's quite sexy. The lips now. Souriez, smile. Alors, upper lip is nice. Souriez. Because I plumbed that, maybe I need to put a drop more here. I mean, we are dealing with a very sexy lip now. But it's a show, we have to demonstrate. Alors, I give my sexy drop a bit more. Souriez, smile, please. Same thing. I go even higher now than before. Now, I press the upper part of the lip, here, tangent, underneath the mucosa, and I plump. See? Same technique then for the upper lip. A bit different, but I increased the juiciness. Let me see. Let me see. Smile. Voilà, that's enough, je crois. Sorry. So, gonna dry up. Voilà, it's enough. I really showed you, I mean, the two extreme. The plumping of the lip is not necessary for every patient. Depends what the patient wants. Okay. Some people want just a simple definition, highlight their own lips. Okay, and some people want plumpy, juicy, sexy, full lips. So I show you the two extremes and how you can deal with it. The technique is extremely simple. Very easy. We just play with a 4 millimeter needle, which you hardly can make mistakes with this size of needle. Faites voir? Sexy, sexy. Voilà. I think it's nice. Smile. Okay. It's already better because I plumbed the lip. It's already better.
Jean-Louis, do you
Oui.
use this needle only for the lip, or do you use for other area?
The nose. The nose. Nose, yes. Nose. It's perfect for the nose.
So it's 0.4 and the
30
gauge?
30 gauge by 4. You have also, you can find on the 30 gauge by 6 and 30 gauge by 12, 13. That's the one which are in the box. My favorite are 30 gauge by 4. 30 gauge by 6, sometimes you can make mistakes. But for the nose, they're absolutely perfect. They're the best needle to reshape the nose with HA. Smile, sorry. Quite sexy, hein? Voilà. Done. Merci beaucoup.
Thank you very much, Jean-Louis.
you.
Thank you.